It is my distinct honor and privilege to present to you a warrior queen. Mary Brown is somebody who I met through the Federal Food and Drug Administration in Silver Spring, Maryland, when she testified before, actually it was a hybrid conference. Mary may remember that sickle cell warriors who were unable to come to the conference were allowed to participate in this sort of audience and patient symposium to find out what symptoms of sickle cell disease and what aspects of sickle cell disease would be most worthy of developing drugs for. And Mary, I remember exactly where you were sitting on the panel, and I remember when we learned that fatigue was just as important as pain for drug development, and you made that point. And then they did a survey, and half of the people, the ones who couldn't make it to the conference, named fatigue as the most important reason. The people who made it to the conference named pain. And since that time, Mary's testimony and all of the work leading up to the drug development in the last 5 years has been influential. Not only that, Mary has now some really good news to tell you about what is happening in the state of California. I won't steal her thunder, but it's big news. It is going to change the lives of those Californians that we showed you are dying more often from sickle cell disease in our day one presentation. Her title, which doesn't do enough justice, is the CEO of the Sickle Cell Disease Foundation in California. She has clearly been at this for 40 years or more, and she has been committed to transforming community-based organizations, building capacity, building partnerships with medical centers. She has made this happen, fleshed this out, made the triad a real thing in California, and serves as a model for what it means to have local, regional, national cooperation to ease the burden of patients suffering with sickle cell disease. Mary, take us home.
Thank you, Wally. Nice to see you all. And as Wally says, I understand you all are at the last stretch of a very important conference that you've had. So I hope that I can just grab your attention for the next little while to share with you information about what we've done here in Sickle Cell Disease Foundation and then where we're going in the future. First slide, please. So my role is to talk about advocacy here today, and advocacy is a defined effort, I think, for each organization. Next slide. It's defined as an action that speaks in favor of, recommends, argues for a cause, supports or defends, or pleads on behalf of others. I don't know how many of you really can see yourself as being advocates, but from a community perspective, from a clinical perspective, and for the work that we're all doing in sickle cell disease, we are all advocates. Next slide, please. The Sickle Cell Disease Research Foundation is where I work today, but we are called today the Sickle Cell Disease Foundation. It was founded in 1957, and we are the oldest sickle cell disease community-based organization in the country. This organization was founded by these 4 African-American physicians listed on this slide. The first slide that I have here, you can see a poster that was designed way back in the day. I wasn't employed at the foundation at this time. I was probably about the age of the little guy that's on this slide, but we started advocating way back in 1957 for persons with sickle cell disease and trying to define and create an organization that would be supportive. Next slide. Our governing structure with the organization has changed over the years. In the very beginning, the Sickle Cell Disease Research Foundation really didn't have an interest in any patient-centered programs. Although our parents and individuals with sickle cell disease were asking for more than a cure, they needed some help. Today, the board of directors that I serve on actually has a hematologist, a family nurse practitioner, parent and caregiver, community leader. We have corporate leadership, arts and entertainment, and public relations on the board. And there actually is a board that we split. We have an executive board of 7 and another board of 8. They come together quarterly for information regarding the work of the organization. This has served us better because there are times and places by which I, as the CEO, have to have immediate response to certain things that are coming up that need board support. So having an executive board really does help me move the agenda forward. Next slide, please. So the foundation is continually evolved, and today advocacy is really what we do. Advocacy seeks to ensure that all individuals and families we serve are able to have their voices heard in areas that are important to them, that their rights are protected, and they have their ideas seriously considered when decisions are being made about the programs and services that we offer. Next slide, please. So how can your organization get more involved in advocacy? Educate. You have to educate everyone. You have to educate even your boards sometimes, because boards of directors aren't always as involved as you are with your boots on the ground dealing with individuals with sickle cell disease on a day-to-day basis. Evaluate your organization's mission, goals, and examine whether or not your current programs involve advocacy. I would largely think that they do. Anytime we are educating or we're in the community, we're looking for resources, we're advocating for people with sickle cell disease. The most important element for me and the success for us has been to collaborate, work in coalitions with groups whose philosophy and goals resonate with yours. Pull together your resources as a coalition and see how better you will be equipped to make change in your community. Next slide, please. Collaborating is difficult and can be very, very difficult. These are some of the questions that I've heard, some of the questions that have been asked, and some of the discussions that we've had in creating a collaboration. How can we all get on the same page? We don't trust what you're saying. Why are you interested in sickle cell disease now? You weren't before. Is there money in it for you? Who has the power in this collaboration? Sickle cell disease needs to stand alone. Why do we have to join in with other people, other groups? They don't care about us. You don't know anything about sickle cell disease. We are going to the top to make sure that we get what we want and need. And then what are your real intentions? A lot of these questions bring to bear unintended consequences. Those unintended consequences can oftentimes undermine what everyone has been trying to do, and that is pull together to make sure that people with sickle cell disease get what they need to have. You have to be careful when you are in a collaboration. And I think the main thing is to really try to be open and sincere and honest about what you feel your community needs, and to work with individuals that have the same intention. Dr. Smith, with his clinical expertise, working with the community, you need those two things together. One can't be without the other. And that's one of the things that we've learned moving forward. Next slide, please. Our first collaboration was with Dr. Darlene Powers, who has since passed, but was the first medical director that I personally met. She was running the summer camp for kids with sickle cell disease. And in 1969, she turned the camp over to us because she just didn't feel that the medical staff at LA County USC Medical Center was going to be able to handle the camp. It needed to be in the community. But Dr. Powers taught me a very important lesson. She said, we have one ship, but we have two captains on this ship. I'm the captain of the medical crew, and you are the captain of the program crew. How are we going to work together so that we don't split this ship in half and sink this whole program? The element of communication and collaboration was live and well. And I'm happy to say that we have had this camp program for 55 years. Next slide, please. The issues in sickle cell disease, in my humble opinion, they haven't changed. Access to care is an issue. Providers that don't have enough education about treating sickle cell disease, not enough money in the pipeline for sickle cell disease research. All these things are and have been hanging over the sickle cell disease population for decades. And in 2018, as a part of a deliverable for the Pacific Sickle Cell Regional Collaborative through the treatment demonstration program, we needed to have a state action plan created. So this is a group, community, clinicians, research, data, all of us got together for 2 days in Sacramento to talk about these issues that we know exist, continue to exist, and have existed. Next slide, please. With that being said, one of the deliverables that we had was to find a medical home for adults with sickle cell disease. In California, Dr. Cage Johnson, who had run the LA County USC program, was retiring. And there were not a lot of places for adults to go with sickle cell disease. And as Wally had said earlier, and apparently as you all have seen, the death of young adults in California was abysmal because there were no access points. In the slide that you see are a doctor, a nurse, and one of our sickle cell clients, patients, their patients, that was part of the beginning of a process. This was the opening of the MLK Adult Sickle Cell Clinic through LA County. We went to Los Angeles County and asked them if they would help us to identify some places. What we got was, in 9 months, a clinic of our own that started this whole process going forward. In the slide next to that, myself, Dr. Diane Nugent, and Judith Baker, we were the core team that was really trying to put a lot of things together. Diane, of course, is a clinician. Judith is policy, and I represent the community. And the three of us never went one place without the other when we were talking about the needs for people with sickle cell disease in our community. Next slide, please. In 2017, the Sickle Cell Disease Foundation was 60 years old. And I had been at the organization for quite some time and was beginning to feel a little antsy. I didn't feel like we had done enough within the organization that made a difference, that really impacted our community. And I didn't want us to keep going around and around and around and around. I even thought, actually, it might be time for me to leave to bring some new talent in. But something told me to stay put and let's see what we could get done. Next slide, please. In the audience for that big event was a gift. The gentleman by the name of Tony Gonzalez is a lobbyist in California. And he was moved by the parent and patient testimonials, He was moved by the honors that we presented to our clinicians and our researchers. He was just impressed with how the Sickle Cell Disease Foundation had worked on behalf of individuals with sickle cell disease with very little resources. And after the event, he asked, "Is there anything I can do to help?" And I said, "Sure, but we can't afford you at all." He said, "Well, I'm not asking you for support financially. I'm asking you what I can do to help, and I am going to volunteer my time to give to you all because I think you deserve to have a place in the state of California. And more importantly, people with sickle cell disease deserve to have better care." Next slide. So with Tony's help, we were able to get a champion, Assemblymember Mike Gibson, who had knowledge about sickle cell disease personally, who had a relationship with Mr. Gil Smith. He was our former mayor of one of the cities in California. And in that poster, again, where you see Assemblymember Gibson and myself, is Jeffrey Smith. And this clinic that is at MLK now is named after Jeffrey Smith. Jeffrey Smith's dad is Gil Smith. So the world becomes oftentimes very small when you're looking at how and who knows about sickle cell disease and how these things can really begin to evolve into an effort that will benefit many. I also said to Mike Gibson that I wanted this to go further than just the Sickle Cell Foundation. And because Tony's initial intent was to make sure that the foundation was financially situated, I decided that it was better that we go statewide and we do something more for everyone in the state of California, not just the Sickle Cell Disease Foundation. Next slide. It took a lot of work to get this done. These are pictures of us at the state capitol. These are pictures of us actually in committee meetings and hearings. And this was really an important role that we played as a community. Dr. Nugent, the young man down below, is a person with sickle cell disease. And when there is an individual with sickle cell disease at the table with me, I have not much to say. And that's because their voice is much more important than mine. They will have my time. So oftentimes at many of these hearings, I didn't say but one or two words and turned it over to the individual with sickle cell disease that we were working with because it's their story, it's their life, it's not mine. I'm here to support. Next slide, please. Again, we met before the Black Caucus in California, and we told our story. The provider advocates were there to tell their story. And again, the patients were telling their story. These are important elements to remember because I think sometimes we forget, we being directors such as myself, and maybe sometimes clinicians forget, it's not about us, it's about the patient perspective, it's about the patient life. And they're the ones that need to have a conversation with others. I will say that it's important that you have a team that does know their lane. I'm not a clinician. I'm not going to speak to those issues relative to sickle cell disease care as Dr. Smith could. I'm not a patient, so I'm not going to speak to what the patient experience is. That person will speak to their experience. I'm not a policy person, so I don't know how to talk about policy and what is or isn't. You have to have a full team of people who understand their role in the process, who can make a difference. Next slide, please. So AB 1105 became the rallying cry in California. This was a bill that went before the California legislature in 2019. The next to Gibson here in the photo is our board chair, Ramon Cooper. And again, how your board sets up, where your board goes, who your board knows. These are kinds of advocacy efforts that I think are critically important as we in the community try to move our organizations forward to work for the betterment of persons with sickle cell disease. Next slide. Today, we have these clinics identified in California. And those stars represent the clinics that are operational right now. The red stars are the ones where the clinics are coming together. By the end of this year, we will have about 12 clinics. And this was made possible because of a $15 million grant that we got from the state of California in 2019 as a result of the advocacy efforts of the Sickle Cell Disease Foundation and the championship behind Assemblymember Gibson. We now are in the third year of this process. We promised the state that we would have 5 clinics, so we have over-delivered. The pandemic has been obviously a big barrier for many things that we attempted to do and should have done, but we've gotten around and over and under the pandemic to make sure that these areas are functioning. And the people now are beginning to really come into these clinics, and we're beginning to show a difference. I will say this, that with our first clinic at MLK and with the clinic that we have at the Center for Inherited Blood Disorders, which is Dr. Nugent's standalone clinic, of 28 patients, we've already shown that consistent medical care has reduced hospitalizations and ER visits, and we've already saved the state of California over $1 million with just those 28 patients. So we see a benefit first and foremost for the person with sickle cell disease, and then secondarily for the state of California. We right now are in the process of asking the state to extend our network for another 3 years so that we can demonstrate, again, really hard numbers and data around the state that show how much money the state will save, but more importantly, how important it will be for persons with sickle cell disease to have better quality of care. We've been very, very fortunate over the last few years to have these resources available to us. Our ask is a little bit bigger than the $15 million. Mike Gibson has decided to champion us again in this event and effort, and I'm hoping that we'll be able to tell you all next year that we've been able to be funded again. Our goal is to really get the payers to recognize the importance of consistent medical appropriate care, and that those payers would make sure that there's reimbursement for persons with sickle cell disease at a level that really does show that consistent, supervised, specialized care makes a difference in the lives of individuals with sickle cell disease. It's a daunting task. Working as an advocate is not for the weak of heart. Just yesterday, as an example, because we're in a time where, the budgets are being done, I thought I had my whole day planned out and got a phone call that we had to stop and turn around and do something immediately within an hour. We got it done, we got it in. I think that the fact that we are able to move as quickly as we have to and to do it well really does bode well for the collaboration and the partnership that we have with Dr. Nugent and the foundation. So I say all this to say that advocacy works, collaborations work, education works. We're not lobbying, we're educating. And when you educate your elected officials there are oftentimes aha moments. And those moments are, I didn't know, I didn't know, I didn't know. That was the resounding response that we got from our legislators in California. I didn't know. We didn't know. So pulling all of that team together, pulling your clinicians together, your policy people together, your community together, and most importantly, your patient population together to advocate for and to be on the same page, to have the same message, whether I'm in the room by myself, is critically important. I trusted everybody on our team, and they trusted me. And we were and have been successful and continue to be, hopefully to continue to be successful as we go forward. But be aware, there are those that don't support you, that don't support us. Let me just say that didn't support us, that undermine us at every turn. And those things are hard to deal with. For me, in order to keep going, I have to stay focused on the prize. And the prize for me is to know that our efforts are working on behalf of individuals with sickle cell disease. It's not about Mary Brown, trust me. I could have gone someplace else a long time ago, but I fell in love with this population and the resilience this population has. And I wanted to be on that team, because when I start complaining about something that's not going well with me, I need to think about somebody that I just saw in the hospital with sickle cell disease, fighting for his or her life. That makes a difference. That brings your compassion and your knowledge and your experience close to the heart. And so when I go to advocate on behalf of people with sickle cell disease, I bring my heart. I don't bring my wallet. I bring my heart. And those are the kinds of ways I think we have been successful. So I think this is the last slide. I want to just thank all of our supporters, all the people that we've worked with, all the people that this slide is a little old, so I need to add more partners and advocates, but all these folks have worked with us on behalf of this work that we're doing in California. And we are positioned to continue to move forward. Wally, thank you for the opportunity to present, and I'm happy to answer any questions that your audience may have. Thank you.
Thank you, Mary. Mary, the comments we're getting is phenomenal. What leadership, what commitment. You're an inspiration. We appreciate what you're doing. I love that you kept it real, Mary. You did not avoid talking about the ugly. I want to talk about the ugly a little bit more, because that's where a lot of us are. We're at the ugly. Yeah. We're 40 years behind you. So tell us about the ugly beginnings and what happened to get you interested in sickle cell disease, and what was the nature of the difficulties in those first lean years that you yourself were involved, not necessarily going back 50 years to the beginning of the organization, but you yourself and your beginning of your involvement. And I'm sure somebody's going to ask, well, what kept you going? And you already said the answer is you saw those patients and they motivated you. But talk about that.
When I first got involved, I was excited, to work with sickle cell disease. And I really felt that there was something that I could bring to the table. I mean, obviously, I came in as a volunteer working with the summer camp program.
Okay, let me say that one more time. You came in as a what? A volunteer? Did I hear the word volunteer? You didn't get a salary?
No.
This generation wants a salary for anything they do. And I think that's going to be the reality, is it not, that most work done on the part of CBOs is going to be volunteer work, at least at first. Would you agree with that? Yeah.
at first.
Yeah. Now let me ask this, Mary. It's a different funding climate, but I want you to answer this one for me too, while you're telling your history. It is a different funding climate. Is it realistic that a CBO should expect to be self-sustaining financially in 2022?
That depends on where you start. I think CBOs, at least the ones that I know, need to build capacity. And I think that that's a slow drag, because it's interesting to think that you, as a community-based organization, can manage, let's say, $1 million.
Yeah.
When you haven't had a full-time staff. Ever. When you don't have a functioning board, when you've had small fundraisers. And again, when you talk about the ugly, that's the ugly. We were the ugly too. And today, we don't manage this money from the state because we didn't have the capacity to do that. That had to be my truth. Yeah, we were out there. If it wasn't for the foundation, we wouldn't have gotten those dollars, because Tony came to an event for us. But when it came to $15 million and managed $15 million, oh, heck no. There was no way that I wanted to say we had the capacity to do it. We did not have that. So the trust that we had to have with the Center for Inherited Blood Disorders became front and center. And that was just our reality. A lot of people said, well, you gave that money away to those people. Who's those people? Those people were us.
Yeah.
Those people were us, because we are at the table, and we had our budget. They had their budget. The clinics are open. The proof is in the pudding. But we as a CBO had no capacity to take on that kind of financial responsibility. There was no way.
Yeah.
And I think CBOs need to be very clear about what they can and cannot do.
So I'm going to say out what I think I just heard you say. You start as a volunteer. You have a very small financial budget and a whole lot of passion, and you take advantage of community resources, and you fly like that for a while, demonstrate value, demonstrate outcomes. Then you go to the next step of trying to bring more money in. And as you bring more money in, you continue to demonstrate value, and you collect all these partners that you just showed us on the screen. I'm guessing you went to some partners and they said, nope, don't want to work with you. Did that happen?
No, it didn't.
Great.
Fortunately.
Great.
But I do think, Wally, the truth is that there was always a demonstration of what we could bring to the table. You have to bring something to the table. And one of the things that kept opening doors for us was our summer camp program for all of our clinical partners. You know, we were taking some kids to camp. Why not? And it was going to be free. And guess what? And we had to be the ones to raise the money. But we also needed a Wally Smith to come and help us, you know, be one of our medical directors for that week. So it kept building the relationship between the community and our clinicians. All of that just kept building and building and building and building. And then it was we got to a place over the years where we were all one.
Yeah.
We were all one, but we had to keep building those relationships. It takes a lot of time.
It takes time.
Being a community-based organization is not part-time work. It's not part-time. And you're not going to be able to spend the kind of dollars that you'd like to for your staff. You need a staff that basically will volunteer, you know, until you get those resources. But if you've got the right kind of people that are working in a collaborative effort, it's a win-win for everybody, but more importantly for the person that has and the families that you impact with sickle cell disease. You got to give. You got to give some.
Beautiful, beautiful. Well, we have others in the room that may have some questions. Some of our staff who are here, who are listening, we're all trying to form this quadrad. You probably missed my little demonstration of what a quadrad is. It's the adult pediatric CBO patient quadrad. That's our quadrad, and we're talking about that. Your quadrad evolved out of, I would say, years of just mutual projects working together, and the idea of trust came out of shared experiences, it sounds like. Yeah. Can you tell us one of the first few projects that you shared together? The camp was one. Was there another one?
Yes. I think another one, an important one, was our social worker. We did not hire a social worker in the foundation until 1984, I think it was, and that was under Peter Graham's. And that's because the social workers were all coming out of, the clinics and the institutions that we were working with. However, the issues kept rising that we don't have as much money to support sickle cell disease resources at the institutional level. And we need to have somebody that's in the community to help us do that. So the foundation, I was not the director at the time. The foundation hired a social worker, and he began to do that outreach to all of our institutions that we work with, to work directly with the social workers to look at what the needs and the issues were. One of the things that came up as we worked with Children's Hospital Los Angeles was the need for transition, way back in the day.
Way back.
Transition is always going to be an issue. And then there was, of course, the older adult population. And I'll say this about the older population. They're really mad at us. Really, really mad at us because they felt like all of our efforts were for pediatrics and nobody cared about the adults. And that, I think, to this day, for some older, like really older adults in their 50s, mid to late 50s and beyond that, they're still mad, because and I understand it. They have had to hobble together their health care. Mm-hmm. They've had to come to a zone of comfort that they have created for themselves, which they feel had very little support. Mm-hmm. And even though we're there within the clinics, those clinics are probably being seen by people under 45 maybe. Mm-hmm. We haven't done that demographic yet, but the older adults, they really have some concerns. As much as we've tried to make it better, that's one of the ugly parts, Wally. Okay. Okay. We haven't been able to please everyone, mm-hmm. Although we try. Mm-hmm. Mm-hmm.
Well, these have been some wonderful nuggets, Mary, and I trust that we recorded all of this because I think that this talk could be replayed a number of times around the country with great benefit. It's easy to look at this and think of it as an overnight success when in fact it was 50 years of being underground and you finally came up out of the ground, 5 years ago. And I guess that's the hard truth, is it not, of making something that's worth something. You often have to labor in anonymity for decades before you become a, quote, overnight success. We want to thank you for that. We want to thank you for hanging in there. And now everybody's going to look at you and say, why can't we be like Mary? And the fact is, they don't know what they're asking for sometimes. But nope. we all marvel at that number you gave us, $15 million. That just, I think that's a beautiful testimony as to what you can do if you continue to work and collaborate the way that you have. So I want to thank you for coming and wish you well. We've been giving shout outs to California. Oh, please.
One more thing to you,
yes.
Wally? Can
yes.
I just say one more thing?
Yes.
Our ask this time from the state of California is $30 million.
I don't blame you.
So if we get the 30 million, then I think we've really capped it.
I don't blame you, and I hope that you do. You missed Wanda. She was on a minute ago talking about the Detroit version of what you've got, and we're excited for Michigan. Great state of need, and many other states. Virginia, we were able to get $800,000 for our adult programs for the first time this year. 2 awards have been made. We expect 2 more awards to be made for different regions of the state. We asked for way more than that, of course, but similar. We took your script. We applied your script for the state of Virginia, and
stay with it. It's coming. It's coming. Don't give up.
Thank you.
Just begin.
Thank you so much. All right, I'm going to give you applause. I know everybody's probably muted, but thank you so much, Mary. I think you did what we asked. You brought us home. You made everything that we talked about over the last 4 days come together with a real life example of what can be done. So thank you, Mary.
Thank you, Wally, for the invitation.
All righty.